Well, this is the Ask Dr. Wilson show. I'm your host, Dr. Nick Wilson, and we are talking about the coronavirus this week. We're going to go into and take a deep dive into the CDC coming out and saying 94% of coronavirus deaths, that coronavirus was not the only disease listed on the death certificate. You're seeing this being spread across social media, saying that only 6% of cases were solely attributable to coronavirus itself. So what's being said across the social media platforms is that only 6%, so less than 10,000 people, have only died of coronavirus itself. We're going to take a deep dive look into if that's actually true. We're going to fact check the fact checkers because the fact checkers have already gone at it and said, hey, that's not the case. So we're going to really take a deep dive look into that. But also we're going to talk about how to protect you and your family when it comes to not only building a strong immune system, but really a mindset of success and not give into some of the fear or anxiety or depression, which, by the way, is at an all-time high, 600% increase in anxiety and depression. You saw 1 out of 4 young people contemplate suicide in 1 month alone during the summertime. And so the reality is that it is imperative right now to protect your and I's minds, your and I's families, but also our younger children, how they are being raised and how they're growing up with the view of their body and then also of germs and either having faith or fear. So we're going to get into that. But let's take a dive into the CDC. So the CDC comes out and says only 6% of COVID-related deaths are attributable to COVID alone. So on the death certificate, what they're saying on the death certificate, 6% of deaths on the death certificate, only COVID-19 was listed. Does that mean that in all the cases that only 6% COVID-19 was the only cause of death? Well, here's the reality on that, is that most people who are dying from COVID-19 had other factors. Obesity, they had heart disease, they already had pre-existing lung conditions that would be on the death certificate. So here's what the fact checkers are saying on this, is that that's not actually true. And I'm going to quote this, and this is from Ryan McNamara. He's a postdoctoral fellow at the University of North Carolina, Chapel Hill School of Medicine. And here's what he says. Those saying only 6% die of COVID-19 alone or some derivative thereof don't understand how infectious diseases work. Many are not operating in good faith and are the same people who have downplayed this pandemic since February. Well, here's the reality, that if you're healthy and you have a healthy body, your likelihood of dying from the coronavirus is 0.00023. So let's be real here. That's 0%. If you are healthy, you have virtually a 0% chance of dying from the coronavirus. And so what should we be focusing on right now? The 0% chance of you dying from coronavirus, and so we shut down everything? Or should we be focusing on the 94% who have underlying health conditions that predispose them to getting sick? Where should our public health attention really be? Wearing of masks for those who have no existing or pre-existing conditions? Just waiting for the vaccine that is untested, unproven, rush to market at warp speed for those who have zero underlying health conditions? I mean, just consider what this message should look like. It should be, hey, if you have diabetes, if you have obesity, if you have heart disease, if you have a history of cancer, here are the 5 steps that you take in order to get healthy, to lose weight, to lower your blood sugar naturally, to maybe reduce your dependency on medications. But that's not the message at all, is it? The message that we currently have is, hey, if you have these pre-existing conditions, hey, social distance, make sure you wear your mask, make sure you wear it properly. Oh, and hey, wait for the vaccine, because when the vaccine comes about, we can all get back to a new normal. With the coronavirus survival rate being virtually 100% at this point, tell me what the need of the vaccine is for. You say it's not about you, it's about you protecting me. Well, asymptomatic spread of any virus has been shown to be extremely rare. Just listen to what Dr. Anthony Fauci says about the asymptomatic carriers in the risk of spreading any virus whatsoever.
That even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person. Even if there's a rare asymptomatic person that might transmit, an epidemic is not driven by asymptomatic carriers.
Well, there you have it, straight from the horse's mouth. A pandemic is not being driven by asymptomatic carriers. So to put it another way, this pandemic is not being driven by healthy people. It's the sick people. So where should our attention go? Our attention should go on getting sick people healthy. Does that mean we wait for the vaccine or we put them on more drugs? No. The idea should be, hey, let's do everything we can to focus on building health, building a strong immune system, and not avoiding our microbial world, not trying to disinfect our world, avoiding contact with other people. Our immune system needs exercise. It needs exposure. The minute that we stop doing these things is the minute that we make ourselves sick immediately when we get exposed to it again. Think about this. Think about a first-year teacher getting sick. A first-year teacher is more likely to get sick. Why? Because that teacher has not been exposed to the germs in the microbial world. And that first-year teacher is much more, people know this, much more likely to be sick than a second, third, fourth-year teacher. A first-year doctor, the same thing. Why is that? They're not used to being exposed. The minute that we go back to normal, and yes, we will get back to a normal, and the minute that we get now re-exposed to our microbial world, the concern now is, what does our immune system look like on the back end when it hasn't been exposed, when it hasn't been exercised? Some will tell you that we wait for the vaccine, and that's the answer to this problem right here. And if you've seen this recently, the FDA said that they are considering skipping phase 3 and bringing the vaccine to market. If this is true and they skip phase 3, remember phase 3 is where you have large scale testing. So they're going to warp speed a vaccine to market with being untested, unproven, and the testing will be on the general population. And doctors are speaking out saying, wait a second, they can't do this. You're going to lose public trust in the vaccine and in vaccines in general. You can't do that. But the FDA commissioner is saying that this is a possibility, and yet we still have some people who say, when the vaccine comes out, I will most certainly get it. As long as the FDA has cleared this for safety and efficacy. Well, the FDA is considering skipping that part and bringing it straight to market. And that means that large-scale testing, and by the way, the testing that they've had so far is on healthy people. So now give that to somebody who's diabetic. Now give that to somebody who's obese. Now give that to somebody who's elderly. Oh, by the way, which is also what COVID-19 seems to infect highly. And now watch what happens. You have medical doctors, such as Ashish Jha, who's a very pro-vaccine, so he's a vaccine proponent, saying you're never going to get lifelong immunity, especially from a vaccine. So understand this, that there's no vaccine that's ever been brought to market that is 100% safe and 100% effective, and you're especially not going to get that with one that's been warp speed, rushed to market, and now skipping phase 3. You want to be a guinea pig, go ahead. But you try to mandate this on the general population and you're going to have outrage. So listen, we've got to think, but we've got to think independently of the mainstream narrative currently. We have to be smart about our decisions, and we have to turn off the things that are really causing us to have fear and anxiety and make decisions out of those emotions. So here's the deal. In the next week, the next weeks, here's your challenge. Turn it off. That's mainstream news. That is social media where you might be getting some of your mainstream news opinions. We turn that off. We turn off anything that is causing us, this low-level unrest or fear and anxiety. We turn those things off, and we turn on the things that cause us joy, that bring us peace, that bring us rest. We spend more time outside. We spend more time with our family. Because if we just turned off the mainstream news and we stopped widespread testing, well, there you have it, folks. That's the end of the pandemic, and we can all go back to a normal that will exist and does exist if you and I continue to fight for our rights. This is Dr. Nick Wilson. You can find me facebook.com/AskDrWilson, on Instagram, AskDrWilson. Get on YouTube, where we're putting a lot of videos, a lot of content up. It's the Dr. Nick Wilson channel right there on YouTube. And you can also find us on any podcast where podcasts are played. Again, it's the Ask Dr. Wilson show, the Detox Lifestyle. This is Dr. Nick Wilson, and we'll see you next time.